Hello everyone, this is Parth Ardeshana. Welcome to our podcast where we talk how technology and AI can solve real world problems. So today's guest is someone who works where life and death decisions happen every day. We have Dr. Shivang Patel. He is a critical care expert and general physician with more than 15 years of experience helping patients in life-saving situations. So today we'll talk about his journey, real ICU life and how technology can useful in healthcare. So Dr. Shivang, welcome to the show. Thanks for coming. How are you doing?
I'm very fine.
Okay.
And how are you, Parth?
Yes, I'm good too. Thank you. So let's start with your journey first. So tell us about your journey so far.
Okay. So I did my bachelor's MBBS from BJ Medical College, Ahmedabad. Then I did my post graduation from Savai Mansingh Medical College, which is SMS Medical College from Jaipur. And then I pursued my super speciality in critical care from CMC, which is Christian Medical College in Vellore. After I finished my studies, I came back to Ahmedabad in around 2020. At that time, COVID was going on. I joined GCS Medical College. I worked there for 1 year, approximately 1 year. Then I joined Marengo Sims Hospital in Ahmedabad. After that, till now, I am working as a consultant in critical care in Marengo Sims Hospital at Ahmedabad.
Okay, great to hear. So why did you choose critical care only?
So when I completed my MD medicine, I had various choices. But I thought that I want to be exposed to a challenging branch. Critical care is where the patients are most sick, and they are all different. So first of all, it is very challenging. The second thing is, I really wanted to contribute to someone's life, and this is the place where I am going to make a difference of life and death. So I think critical care is the branch where I save a person's life in a real sense, which is not there in many other branches. Okay. So that is the main reason I chose critical care.
Oh, amazing. So and what is the one ICU moment that changed like how you see life and the medicine?
Okay. So recently I had a patient who was around 69-year-old, and he got diagnosed with some kind of a blood cancer, and he was in very bad situation. So he was almost near to death, and most of the doctors suggested his relatives that we should not continue with the treatment very much. But his daughter was very persistent that no, she want to continue the treatment, and we continued the treatment. So despite all the odds, that person survived, and now he is walking, and that is all because of the hope of her daughter.
Yeah.
So I think many of the times, even when doctors also are not very confident that the person will survive, but whenever there is a hope from a relative side, we do continue. And fortunately, many of the times we are also wrong. So that day changed my view of life, that whenever I consider that this person cannot live more, but if there is a relative who wants to try all the things, I have to give my best.
Yeah, that's amazing. Sometimes hope is also works really well.
Yeah, I think that is very important part of overall treatment.
Of course. Yeah. And what are the biggest challenge you face in daily like your life, especially while you are into the critical care or your operations or daily?
Very nice question. So I would say biggest challenge is communication between different parties. So in this case, I would say communication between caregivers. For example, in an ICU, 4 or 5 or even more than 5 doctors are seeing one patient, and many of the time it happens that everyone is not on the same page. Everyone doesn't have the same information. So there is a communication gap between doctors, different doctors, doctors and nursing staff, doctors and physiotherapists. So there is a communication gap which exists. That is one part. Second part is communication between doctors and relatives. Doctors do explain many things to relatives, but then one patient has many relatives.
Right.
And after 5 days, a new relative comes
Yes.
and they will ask the same question again and again. So, many a times the communication with the relative is also difficult, especially when the patient's condition is very serious.
Yeah.
So, I think communication is one of the challenging part of my job.
Yeah. And you have to repeat again and again, like when new relatives are coming, right?
And many of the times we feel that whatever I wanted to communicate to the patient, the message has not, gone through clearly. So
Okay.
understanding
Right.
between doctor and patients are sometimes lacking.
Okay. So currently, how do you manage this communication? Suppose on one patient, the 3 or 5 doctors are working parallelly, right? Maybe on a shift or something, right?
Okay.
So how do you manage that communication? At what stage the patient are and
So usually what we do is the patient is admitted under one doctor. Mostly that admitting doctor is the primary communicator with the relatives.
okay,
And the other doctors who are also involved in the care of the patient will communicate only their part of the treatment. For
Okay.
example, I am a critical care specialist and if I am treating a patient, I will explain overall situation of the patient. But if I have involved a nephrologist, which is a kidney specialist, some kidney problem will be explained by the kidney specialist, like
Right.
whether they need a dialysis or not, or what is the plan going forward for the kidney, how long we are going to continue
Right.
dialysis. So overall communication is usually done by one doctor, which is admitting doctor or treating doctor,
Yes.
and part by the particular
yes.
specialist.
And major decisions are taken by the like assigned doctor only, right? Based on the like
Yes.
different
So
doctors
major
appointed.
decisions are taken by the major decisions are taken by the treating doctor and relatives. It is
Yes.
the relatives who are taking the decision and not doctors.
Okay.
So doctors are usually suggesting that we should do this.
Yes.
For example, that we should do we should put a patient on ventilator or we
Yes.
should do a dialysis, right? So that is my opinion.
Yes.
But in reality, the decision makers are the relatives of the patients.
Okay.
Because they have a right to say yes or no
Yes.
to the patient's treatment.
Yeah, that makes sense. Without their permission, you cannot start the treatment, right?
Yeah.
Yeah, that also makes sense. So, what skills are the most important for the critical care doctor?
Okay. So, first of all, knowledge, because in critical care, you need to know about all the systems of the body. So, knowledge is very important. Then, critical thinking, because there will be at least 5 things possible for a particular patient, and you have to choose 1 or 2 things to pursue. That is critical thinking. The third thing is communication, as I have told you that everyone should be on the same page.
Yes.
And for a critical patient, it is very much required that things are communicated properly. And the other thing is hope. I think hope is the most important thing for a critical care specialist, because if a treating doctor loses hope entirely, then there is no one there to save the patient.
Yes.
So a critical care specialist doctor has to have highest level of hope
Yes.
that this patient will survive. Then only they can give their best to save a patient.
Right. And the same equally, like also in the patient side, also like the hope should be required, right?
Yes, it only works if the patient relatives has hope. If they do not have hope that we want to save our relatives,
Yes.
doctors can't do anything.
Yes.
So if patient relatives have hope, then next comes the doctor.
Right.
So the doctor who is treating the patient must have hopes that he is going to save the patient. Then
Right.
only it works. If they work without hope, it is
Yeah.
not a very good
Correct.
situation.
That also makes sense. Yeah. And what type of patients do you mostly see in ICU?
Mostly we see patient, so there are different kind of patients. Mostly in ICU there are patients who has say breathing problem, or who has severe infections, or those who have uh, been in a very serious accidents and multiple injuries. Apart from this, many patients whom I can say that we can avoid admission in ICU are the negligent patients. Those who have been having problems for past many days, but they have neglected the problem, or they have communicated with very local doctors, like doctors in a very rural areas, who many times are even not doctors, and they ignore the red flags which their body are giving them. They usually end up in the ICU. Then there are very negligent patients, those who think that nothing can happen to them.
Right.
They also end up in the ICU.
So, like nearby, the right doctor is also important stuffs, right?
That is very important. So for a primary treatment, whom you are consulting is very important, because if someone is identifying your problem when it is very small problem, you will be spared of a very long and lengthy and expensive ICU affair.
Right, right.
Yeah.
Great, great. So currently, like which software do you use most every day? In general, in your life as well your professional life.
So the most used software is ChatGPT and Gemini.
Nice.
Correct. So these are the AI tools
AI
which
tools.
I use very extensively in my life for both medical and non-medical purposes. So apart from AI, what I use most is Up to Date, which is a application for very authentic uh, information of medical science. So that is a subscribed application which is available for both doctors and patients as well. But that is an excellent and very reliable source of medical information. So I think these are the applications I use.
Okay. So is
almost
it
daily.
application about for the critical only, or like it is for the all medical?
It is for all the medical fields, and it is a US based application.
Okay.
And see, it is regularly updated by experts all
Okay.
across the world. So even recent advances also will be updated in this application,
Okay.
which are even not there in the standard textbooks.
Oh, nice.
So it is a very reliable application, and I have seen many doctors using it, and it is increasing day by day. So I have been using it since my post graduation days.
Oh, that's amazing.
Yeah. So it's very handy. It's very amazing app, and it is helpful for both doctors and of course patients.
Okay. Yeah, that's interesting as well. So what basic health tech should everyone use in terms of software or application or anything which you could suggest?
So a normal person, I believe, after COVID, many people have these gadgets in their house. But let me reiterate it. Every household should have a BP machine, a pulse oximeter, which shows your heart rate and oxygen.
Yes.
These are the most basic thing everyone should have. Because whenever you will have a problem and you will ask anyone, all the doctors will ask, what is your blood pressure, what is your heart rate, what is your oxygen,
Yes.
because that is called vital signs. Vitals means these are the signs which, if they are not normal, it is life threatening.
Yes.
And what everyone wants to know is whether the situation is life threatening or not. If it is not life threatening, it can be addressed anytime, but if it is life threatening, you have to go to the hospital now itself.
Yeah, it's like a first aid box, right? Similar to that.
Yes.
Yes.
And the one more thing I would add is glucometer, which is the sugar checking machine.
Okay.
All the patient who has diabetes
Okay.
should keep glucometer with them. So these are the most basic thing one should have in their home.
Okay. Okay. Great. So suppose if you could imagine one perfect software for doctor, so how should it would be?
A very difficult question to answer because I don't know anything is perfect. But let me try to imagine a perfect solution for myself.
Yes.
Right. That's what I can do.
Yeah.
So first thing I would like to know is, let us say a patient comes to me. The patient's history should be there. So if I have seen the patient in the past, or if somebody else also has seen the patient in the past, all that information should be there in that software, right? So any blood reports, any images done anywhere should be there in the software.
Like medical records of all the history.
Yeah, medical records of blood tests, of any radiological imaging, or if they have consulted any doctors, it should be there. Then there should be basic informations of his family life, like if his father has something, his mother has something, his any blood relative has suffered from anything major when they are young, it should be there in the software. So that is a history part.
Yeah.
Correct. Now there should be suggestions for the current problems also. So whenever I enter current problems, it should give live suggestions according to the place and time. So what I mean by that is, let's say we are in Ahmedabad. So in a Gujarat, in a January month, what is the common problem going on currently? Let us say it is a influenza or a particular type of influenza virus. Let us say it is a H3N2 influenza virus is going on in the community. The software must know.
Okay.
By communicating with all other softwares that okay, this is the common problem which is going on right now in Ahmedabad, right?
Okay.
So my patient also have a high likelihood of that happening.
Okay.
Second thing is, if a patient has traveled somewhere, let's say patient has gone to Jaipur, or let's say patient has come from US, the software must know what is going on in Jaipur or US also.
Yes.
Correct. So they can give me clues, because I won't know what is going on in US.
Right.
Correct. So it should be able to give me clues that patient has recently traveled here and this particular thing is going on there, and patient might be suffering from that also.
So for the audience, what do you mean by influenza and what are the symptoms of
So influenza is a common cold. So it is a common cold virus. Influenza is a virus like a coronavirus, COVID virus. It's a virus. It's a commonest cause for this common cold.
Okay.
So basically, live software must be aware of live situation everywhere on the earth.
Right.
So if one person goes to the other place, I might miss, but software should not miss that this might be the possibility. Correct. And after that, whenever I write a treatment, software must be counter verifying with their past history. Like this person has suffered allergy from particular drug. Okay.
Yes.
So if there is a cross allergy, so some other drugs which is similar, and if advertently I have prescribed him, software must identify that.
Yes.
Or if there are two drugs which are cross reacting with each other for this particular patient, software must be identifying this.
So nowadays AI is more powerful to analyze this data and whatever the scenario you are talking about, which is really capable nowadays as well.
Yes.
Yeah.
So software must be advising me on the problematic things of my treatments. Correct?
Yeah.
So software should be doing all the things which is difficult for a human to do.
Yes.
So human cannot know, cannot have this much information all
Yes.
at once. Correct.
Right.
So, but a software can have.
Yeah.
So this,
And definitely that data particularly giving you a more idea about the patient and along with the history and everything.
Yes.
So it would be very easy to treat that particular patients as well.
yes.
Yeah. That also makes sense. So what advice do you give to the normal or like a people to stay healthy?
So it's a very generic advice,
Yes.
and everyone knows that.
Yes.
है ना?
But
That-
nobody follows.
Yeah, it is very difficult to follow. Knowing is very easy, doing is very difficult.
Yes.
So advising is very easy for me, so I will be doing easy part. So let me give you advice.
Yeah.
Like, so exercise daily around 30-40 minutes should be a part of a normal life.
Yes.
Okay. Eating healthy food.
Yes.
And what I mean by healthy food is, there is a definition for junk food and there is a difference. So healthy food means which contains more of a protein, salads, means fibers,
Yes.
and low calorie things,
Yeah.
and less of a carbohydrate. So, and this, they should contain essential vitamins and minerals in reasonable amount. Okay,
Yeah.
so this is what healthy food means. We should not eat too much fried or processed food. That is the general
Yes.
advice for everyone. Apart from that, to lead a healthy life, there are two important things which I would like to emphasize on. One thing is vaccination. So we are very much pro for vaccinating our children, and almost many people will vaccinate their children, and we have seen the benefits also.
Yes.
We have eradicated smallpox from entire world, and we have eradicated polio from India.
Nice.
Okay, that is unprecedented in the history of humankind. Now, these vaccines have a potential of reducing diseases, very serious diseases, to very, very low level. But we are using that in children as of now. Nowadays, there are vaccines available for our adults also.
Okay.
So, most of the patients in ICU are elderly patients. So, we know that our elders are getting more infections and they are getting to the ICUs.
Yes.
So, there are vaccines available to prevent these infections in our old age life. So, there are pneumonia vaccines, there are herpes vaccine.
Okay.
These are available, and I think everyone should be, focusing on this adult immunization also, which will prevent serious diseases. Pneumonia vaccine will not prevent all pneumonias, but if you or I will have a pneumonia, the severity of the pneumonia will be less, and if I am going to be very serious, I will not be very serious, I will be less serious, and I will get away with a lesser disease.
Okay.
So overall burden of disease will decrease on the entire country, and that would help us a lot.
Yes. And that is completely safe, right?
Completely safe. So we are talking about this safety. Let me tell you one thing. There is nothing called completely safe.
Yeah.
Okay. So if you drink too much water, you will have problems.
Exactly.
So if a water is not completely safe to have, you can imagine there is nothing in this world which is completely safe.
Exactly.
Not water, not air.
Yes.
Okay.
Yeah.
So what we should see is what is the risk and what is the benefit.
Yes.
Risk is very minimal.
It's like
in
a risk
taking
reward.
vaccine. Yes. So we are giving our children and we
Yes.
can see that it is not causing much problem in children.
Yes.
Then why should we be worried about our adults?
Yes.
है ना?
Yeah, of course.
So there is ample of proof that vaccines work, and one should take to stay healthy in their elder life.
Yeah, that's really great insight, like which you have given. And how can watches like smartwatch and app help in daily health, or like to be like very healthy?
Okay, so there are two aspects of that. One aspect is monitoring.
Yes.
So all these devices, tracker devices, are basically monitoring devices. That how many steps I have, taken, or what is my heart rate. To see the number is a motivating thing. So the things which you do not monitor, you tend to ignore. So if you are trying to lead an healthy life, and if you see that I am achieving some targets, you will be motivated to do that regularly.
Yes.
So one thing, it is motivating you to do these things repeatedly.
Which
That
is more
one thing.
important part?
That is one important part. There is second important part, which is identifying the problems which we do not know. So many of the times we have underlying heart rhythm problems. Let us take atrial fibrillation, which is irregular heart rates. Now a normal person would not know unless they will do a ECG, that is electrocardiogram. So, but this fitness trackers, which is the watch that can identify irregular rhythms, even if they are happening at a interval. So let me explain you a bit in detail. Many patients will have intermittent, means they will have a normal heart rate for some time and they will have a irregular heart rate for some time.
Okay.
They are also exposed to the similar risk of cardiac problems,
Yes.
heart problems. So if you are wearing a watch, you will be able to identify, watch will identify that you are having a irregular heart rhythm, and that will, prompt you to go to a doctor. They will do tests and you will be treated for that. So identifying the problems which you do not know you have, that is one thing.
Yes.
And keeping you motivated to lead a healthy lifestyle. I think these two are very great advantages of using the health trackers.
Yeah, that's true. That's true actually.
Yeah.
So which app track steps, heart rate and sleep? And do you this number really matters? So whatever.
So I think all the mobiles now have these apps that tracks all this information. And more or less all of them are pretty accurate. Unless you are doing a very athletic stuff, I think all softwares which are in Apple or Android pretty good enough to have a decent idea of our daily activities, right? Garmin is one of the watch. If you are doing professional things like athletics, or you are doing a trekking, then they have a lot of features which I think is one of the most used or advanced watches you can have on the market.
Yeah, great.
I think that's for that.
Yes. So can fitness app help people to avoid reaching to ICU?
Yes, definitely. As I have told you, as of now, the best use is for ECGs. So if you are having a irregular heart rate, it can identify, and in some cases, if you are having a heart attack, that also it can identify, because there are limited capabilities of ECG. But if you are having a heart attack of a particular area, your watch can tell you that you are having a heart attack, you should go to a doctor. So it can really save your life in real time. And then there are, I think, this crash alerts also by various watches.
Yes.
That if you are in a sudden accident, it will identify and it will prompt your emergency contact that this person might be involved in accident with your location. So your relative will know immediately, even if you are not capable of informing them. That can lead to a...
That's really help.
Yeah,
Yeah, of course. Especially in the emergency conditions as well. So like let's talk more about AI as well. Like what excites you the most about AI in healthcare?
So AI is very exciting field. I use it very extensively for both my medical and non-medical things. For medical purposes, what excites me is it has amazing capabilities and of course it has amazing knowledge also. So whenever I am stuck with some case that I am not, identifying, I am not diagnosing, or I am not satisfied with my diagnosis, I take an opinion of AI. Second part is whenever I am stuck with the response of the treatment. So I know that this is the problem and I am treating, but the desired response is not very adequate. At that time also I consult AI. One more use case I will tell you is I am a critical care specialist, so I know about my specialty. But I do not know about dermatology,
Yes.
for example.
Yeah.
So for a doctor also, they know in depth about their own specialty, but they do not know about other specialties. So for example, I want to know something about dermatology, I will ask AI. So for dermatology, I am also not very expert person. So I also will be exposed to other medical specialties, and I will get a lot of in-depth knowledge, and my knowledge also will improve by just using
Yes.
AI.
It's
So
like a
for
buddy.
now, for now, AI is a helper tool for me whenever I am not wherever I am stuck.
Yes. It's like a buddy, like where you can discuss your case.
Correct. Correct.
Exactly. And what worries about the AI?
Okay, so this worry is AI is not always right.
Yes.
Okay, so whenever I check with AI, I have to double check with something else also.
Yes.
So it is not that I can trust on AI blindly. So whenever I do consult AI, I make sure that I follow up with proper questions, and I check in other sources also. And the most important thing is that your question should be correct. Many a times AI will give you the answer how you formulate your question.
Yes.
So using a AI by me for medical things, I can differentiate between right or wrong answers many times, but a layman person who is using AI for their own medical problems might get diverted in wrong direction because they do not have even basic knowledge about differentiating right or wrong things. So trusting blindly on AI and taking treatment on the basis of that is one worrisome part. I would like to give a small example.
Yeah, please.
I have a 4-year-old son and he had some skin issue on his skull. I took photos and I uploaded to the ChatGPT.
Yeah.
And I asked him, what is this? So AI said that this is most likely a fungal infection. Now I have my sister who is also a dermatologist. She was not in the town, so I texted him the photos and I asked her, and she said this is a bacterial infection. And the difference between two things is fungal infection has to be treated for 6 weeks, that is 1.5 months, and bacterial infections need treatment for 3-4 days.
Okay.
Right? But as I was a medical person and AI gave very solid reason that why this is a fungal infection, I distrusted my sister that because she also has not seen my son and she has also seen only photos. So I thought that okay, there might be a conflict, and I am also of course not an expert on this problem. So I consulted another dermatologist
Okay.
in person. So another dermatologist also told the same thing, that this is a bacterial infection, and she described me in a detail that why this is a bacterial infection and not a fungal infection. Then I was convinced that this is not a bacterial infection. I
Yes.
treated my son with for 3-4 days and he was all right.
Yeah.
So it was proven to be a bacterial infection.
Yes.
In this place, if I had not consulted dermatologist and I have treated my son with the fungal treatment, one thing I would have delayed treatment of my son, and uh, I and after many days I would have known that okay, this was not the correct thing. So
Yes.
here, even me being a medical professional will get lured
Yes.
or convinced by the fancy language of AI. It is very easy for non-medical people to get convinced by AI that they have some particular problem which they do not have.
Yes.
Correct. So asking right questions and doubting the AI is very necessary skill
Yes.
to use AI.
Yeah. It's like we have to use AI very wisely, and especially when it
Yes.
comes to the healthcare industry, right?
Yes. And that wisdom should not come at very great cost.
Yes.
You know what I
Of
mean.
course, yeah.
It should
Yeah.
not do. You should not do damage to yourself, and then that wisdom should come.
Yes.
You should be wise enough to stop.
Yeah. To
and take
doubting
a-
on AI as well. Yeah. Absolutely. So as country like Dubai and US, right? Currently they are moving very fast in healthcare, special digitalization and all. They are doing heavy developments into their EHR system, EHR, and there are some. You can say like suppose if you'll pick the US, there are some compliances like and in Dubai there are PDPL compliances, HIPAA compliances in US, right? So what do you suggest or like you can basically for the India, what it should be, or like our government should learn also from there?
So first of all these developed countries has a lot of resources which our country do not have. But health is a big problem, or health is always a big issue for any country, not only our country, right? Because a healthy population only will lead to a growth and stability to a country. So health must be a priority for our government also. What we need currently is a solid data management by government.
Yes.
Like you said, EHR and EMR softwares are very important, and they are the backbone of the entire country's health. So as of now, we do not have any infrastructure
Yeah.
to store all this information and to get access to all the information. I think government has started some project,
Yes.
but they are in a very initial phase,
Yes.
and I think government should focus on doing this on a priority basis.
Yes.
And all of this should be interlinked,
Yes.
because one hospital runs on some software, the other hospital, the laboratory, the radiology center. If all of these are on different softwares, it is very difficult to integrate things
Yeah.
and get information from this collectively. That is one thing. Second thing I would like to see is a rise of ultrasonography. So you might not be knowing, but ultrasonography, which we call as a sonography, is a great tool for now to identify different diseases. But nowadays, there is a point of care ultrasonography very extensively used in ICU and in hospital all across the world. And their use has gone over and above by only radiologist or cardiologist for particular diseases. And they are being an integral part of diagnosing and managing a patient all across the world. But we have a X like PCP-NDT which prohibits use of this equipment in a smaller setups, or not prohibit in a smaller setup, but it prohibits the use of this equipment from transferring from one place to another place. So every place must have their own equipment, which is very difficult as of now because it is a costly equipment and not each and every place can afford that equipment. So in one place the act is very important, that is true, that it is needed for India. But on the other hand, the machine has great benefits and could be helpful to many patients to save their life also. So there should be some way to accommodate this advancement in medical treatment in our country. So I think these two things
Yeah,
are very
that makes
important for now.
Okay. So, and this would be the last, not the least. So, what is the one message you want to give to our listeners?
So I would say that for the last many years we have seen that technology has grown so good that it is being used in all the fields currently. Correct? Health is also a field where technology is extensively used.
Yes.
Now this is not going to reverse, this is going to increase only.
Yes.
So I think everyone should figure out a way that how technology can help in improving their health on a daily basis or in keeping their own health records.
Yes.
For example, for a very small example, let me say that I keep my and my family's all reports, so blood reports or radiology reports or any other kind of reports or medical prescriptions on a drive. Okay.
Yeah.
So it is there. So I just click photo, convert it and save it.
Yes.
I don't know how is that going to help me, but currently we do not have any infrastructure to save our own information anywhere else. So that should be done by us only. So the technology has great potentials, but that potential is there if you have your own data. So I would, urge my all the people to start using this technology,
Yes.
which is in your pocket, to at least gather your information.
Yes.
And then on a later day, we can always figure out what to do with that data.
Yes, of course.
Correct. So I think that is very simple
Yes.
thing we can all do.
Okay. Thank you very much, Dr. Shivang, for sharing your time and the real life experience which you have encountered so far. To everyone listening, technology can help us a lot, but care, kindness, and human touch will always matter. So keep learning, keep caring, and take care of your health. See you into the next episode.